Controversy continues over how Oregon is distributing the vaccine. We're in phase 1B here in this state of our vaccination plan. That means child care providers, early learning, and K through 12 educators are eligible to get the shot. But some still disagree with the governor's decision that goes against federal guidelines to put educators before seniors. Lindsay Nadrich joins us with today's efforts to change the governor's mind. Lindsay, I got an earful of complaints from seniors when I was at the grocery store this weekend about this. This is one hot topic.
Yeah, and senators tell me they're hearing those complaints too, because there are a lot of people who want seniors to be put first because of their risk of dying from COVID-19. And now there's a group asking the governor to change her decision on that.
Listening to the governor, I was afraid I wasn't going to get it until May or something, and personally, I didn't want to wait that long. So
70-year-old veteran Michael Sprague says he's one of the lucky ones. He got his first dose of the COVID vaccine a few days ago through the VA. He told me he feels relieved and wants others to be able to get vaccinated too.
I think they should be vaccinating the older people in front of the teachers, personally. That's just my feeling.
Michael's not alone in that feeling. The governor's Commission on Senior Services sent a letter to the governor today, urging her to rethink the prioritization of vaccine distribution. The group says 91% of all COVID deaths in the state are people over the age of 60. The letter reads in part, older Oregonians have suffered enough, particularly our traditionally marginalized poor and minority seniors. The time to protect our seniors is now.
It's the CDC recommendations. 45 other states are doing what the CDC recommends doing. We don't understand why Oregon is one of 5 states that is not listening to the science.
The Senate Committee on Health Care also discussed this issue during their meeting this afternoon.
They obviously are very, very unhappy about it. Feel like that, they're being jeopardized. They're in a high-risk group. What would you like us to tell those people who are writing us?
The biggest challenge we're going to continue to have is there's just not enough vaccine. We're trying to make good progress in all these areas. We continue, as I said earlier, to have one of the lowest fatality rates in the country and one of the lowest fatality rates for senior citizens in the country.
OHA Director Patrick Allen said there are profound health impacts to not having kids in school, and that 25% of vaccines have already gone to people over the age of 65. Well, Director Allen said long-term care facilities were included in that first phase because that's where 50% of the COVID deaths have happened. People over the age of 80 will be able to start getting vaccinated on February 8th. Reporting live, I'm Lindsay Nadrich, KOIN 6 News.